All right, welcome back, everyone. We're here for another Q&A, and anything that I say is not meant to diagnose or replace your medical care. Check with your physician before implementing any of the information that I'm going to share with you. On that note, we like to dive right in. Steve, should we talk to Chris right away since he's been waiting patiently?
We sure will. Poor Chris is having little internet issues, or maybe it's us, who knows. But anyway, Chris, I would like you to unmute yourself and prepare for a great time with Dr. Berg. You're on the air. Go ahead, Chris.
All right. Thank you, Doc. I love everything you do. I've been following intermittent fasting, keto for quite some time. You've helped me lose about 100 pounds. I feel great. As far as that goes, I went and got that calcium score, and that scared the bejesus out of me because I'm at a 560 something. So we'll get to that in a minute. Bought all your stuff, watched all your videos, and I'm on a fifth day of a 7-day fast trying to combat that a little bit. And cholesterol, LDL, the bad one's really high. I can give you those numbers. I don't know what's causing all my inflammation. My doctor won't help. I had to fight to get some tests. I thought maybe I had Fabry's disease, but that came back negative, but it's inconclusive. Been taking some of those like Beano things. That seems to help digestion, a lot of gas. So that's where I was kind of leaning with that. I seem like I have a hard time with like broccoli, especially your pills, which by the way, I have almost everything that you sell. And if I don't, I probably, half at it. So last night I actually took too many pills because I've been trying to work on my liver.
Oops. Well, Doc, he dropped off again.
Hey, that's fine. This is recorded, and I have enough information to tell him some things to do. The thing is, though, if you have a coronary artery calcification test, which actually, by the way, is one of the best predictors for not just heart attacks and heart deaths, but also all-cause mortality. So it's a great risk. It's a great way to really see how healthy you are. And the thing is, if you just get one test, you really don't know what it was before. So you just have nothing to compare it to. When you evaluate something, you always need at least two of something, right, to evaluate, or else you don't know, well, how was I before? You can compare it based on normal. And yeah, 500 is too high. I've had people had over 1,000, so it could be a lot better. But here's the thing to know. The most important thing is to do the right thing and then test it over time. So I would wait 2 months and retest it, and it should be coming down. And then we know it's working. So of course, to remove calcium, we want to remove the actual reason why you have calcium in the first place, which is inflammation, oxidation, things like that. So like vitamin K2, tocotrienols is all really important. Going low carb, doing fasting, all those things are going to greatly help. I'm going to be releasing a new video this week on some additional advanced things that you can find out from your blood test, but you have to get an advanced lipid profile to do it. And unfortunately, a lot of the doctors don't really even understand some of these additional things that go beyond just total cholesterol, LDL, HDL. So I'm going to clarify that and give you some. I think the name of this video is going to be the unusual or surprising risk factors that you haven't heard about when you for a heart attack. So I'll talk about that and some of the best things to look at that go way beyond just total cholesterol and even LDL. So that being said, if you're consuming something that is irritating you, especially if you're taking a lot of supplements, you're going to have to back off them for a while and then just introduce one at a time to isolate what is creating that symptom, and then avoid that for a while. And it could be something related to fiber, or who knows what it could be. So that is the problem of taking a whole bunch of things at once. You really don't know what is, making the symptom.
Okay, well,
all right,
Chris, we hope that that gives you a nice answer. I hope you log on and watch it. And I remind everybody, of course, both Facebook and YouTube, the show is recorded afterwards and captured so you can watch it in perpetuity. And Terry, our producer's fingers must be throbbing because he has really done a great job for our social media participants, and we've got a ton of questions. Let's start off with Blue Games. That's apparently the nom de gear that this person uses. From YouTube, I am a 43-year-old female on OMAD, IF, healthy keto, and I'm suffering from severe internal body heat or heat intolerance with little or no sweating. Ouch. Doc, any remedy?
What was the age again that she said?
43.
Yeah, I mean, it sounds to me like it could be like a perimenopausal symptom that is not necessarily a, night sweats, but your body does the thermostat in your body is actually in the hypothalamus, and it's in the same nuclei or the same nerve bundle as where you have other things that are related to menopause. So as this change occurs, could be a little circuitry problem with temperature. And so what happens is you get an increase of two hormones. One is coming out from your hypothalamus. The other one's coming out from your pituitary. So it's called the gonadotropic releasing hormone and also the luteinizing hormone. So that's like kind of compensating for maybe some changes in the ovary. And if you can normalize those, things will probably be a lot better. And I think one of the best remedies for that would be something I'm going to reveal in a video in 2 days from now. I'm going to release a video on that, and I don't want to give it away because I always do that on the show, and then people don't watch my video. So stay tuned for that video on the best remedy for perimenopause as well as menstrual issues. So that would be my long answer to that, Steve.
Well, that's good. And boy, certainly a lot of the population, half of them roughly, that are concerned about that sort of thing. So that's terrific. All right, back to YouTube. Surbai is 24. This is unusual or interesting. My tongue gets red and under the area my tongue is burning with mesh-like structure forming behind my lips. My stomach always burns after I eat. I do not do alcohol, tobacco, or coffee, or tea. Maybe he should start.
Sounds like a severe B12 deficiency. Red tongue, burning tongue. I mean, that's like a B12. That's a B12. Now you said let's say your diet is really good. Well, it could be you have some type of something called pernicious anemia, which is or like some autoimmune condition to what's called the intrinsic factor. I would look at my videos on B12 to see what's going on with that. There's another genetic factor that it's in a video that I did on B12. You have to really make sure you don't take the wrong version of B12. You want to take the natural version, which is the methylcobalamin, not the cyanocobalamin. So watch that video and see if you can sort that out. And one really interesting thing that you might want to consider is to do a genetic test. That's becoming more popular. The genetic tests I really like because you can find out your weaknesses and it gives you a lot of data. The problem is trying to find someone to interpret that data. So, but they're out there. So you have to find someone in functional medicine that really understands what to do with the data.
Wow. Well, we pray you get over that one. That is really awful sounding. What's good sounding is our first question of the day. This is interesting, Doc, and there you have it.
Okay. What increases your, I can't even read that.
Mortality risk, sugar or vegetable oils?
Oh, okay. It's right in front of my camera right here. Okay. Yeah. What increases your mortality risk? Sugar or vegetable oils? So what causes a greater increase in deaths? Sugar or seed oils? Vegetable oils.
And we used to think they were so good for you. Okay, let's find out who else is listening besides our great folks in the green room. And Terry wants to say a good morning to all our viewers joining from the UK, Canada, Scotland, Egypt, Saudi Arabia, Belgium, Trinidad, Tobago, Greece, Japan, Algeria, Cameroon, Australia, France, Germany, Mexico, Sweden, Taiwan, the Netherlands, Turkey, Philippines, Macedonia, India, Norway, Nigeria, Hungary, Poland, Argentina. Haven't heard from them for a while. Bermuda, Brazil, Switzerland, Panama, Portugal, Iceland, the United Arab Emirates. Welcome, folks. Chile, Ghana, South Africa, Pakistan, Iraq, New Zealand, Italy, Peru, Bulgaria, Iran, Guyana, Hong Kong, Croatia. I haven't heard from them in a while either. Spain, Jordan, and all across these United States. And I always accuse Terry of not saying Canada. I don't recall him saying that. But anyway, welcome Canada, in case we didn't have you in there, because I know you all are listening. And then let's go back to social media. Oh, wow, he typed even some more, so I may have missed it. Anyway, Amy from YouTube. Why have I stopped losing weight? I've been on clean keto, and doing extreme workouts. The weight was falling off, but now it's stopped. Help.
Well, I always like to do a periodic video on that topic because, as time goes on, I constantly am finding more data, more strategies, more things to do to speed up that result, because you can always improve that problem of having a plateaued weight. And so I just did another video on it. And there's a couple things that you can look at. And of course, the thing that I constantly keep talking about is to bring your carbs down to close to zero as possible, fast longer. But there's some other things you can do, especially with fats. Like, realize that the more dietary fat that you consume, the less of your own body fat you're gonna use. So we want to mobilize your own fat. So in that case, you don't want to be taking extra like keto bombs or like as desserts, MCT oil. You don't want to restrict your fat like from normal protein, but you don't want to add more fat. That's important. The other big factor, and I'm going to talk about this in the video, is stress. Stress is similar to eating sugar. Why? Because it releases cortisol. What's another name for cortisol? Glucocorticoid. It means it's a glucose controlling hormone. So the more cortisol that increases, the more sugar that your liver makes. And then all of a sudden that raises insulin. So you can even become a diabetic by having this spike in cortisol. I mean, I know of a person off the hand that took prednisone, which is a type of a synthetic cortisol, and ended up with diabetes. And of course, the doctor didn't connect the dots. I'm like, I mean, it was perfectly right after that situation. So that is one of the side effects that is not really promoted and acknowledged when you take these steroids. Unfortunately, I took them every year for many years because of this darn poison ivy problem that I have. So that kind of messed up my adrenals. So on a positive note, if I didn't have all these physical problems, I probably wouldn't even be doing this podcast right here, because I wouldn't be interested in it as much as I am now.
Yeah, Doc was the original Petri dish and has poked and prodded himself through the years. In fact, I remember you talking before, he used to make these sort of concoctions and eat them and turn blue and say, nope, not that one.
I've done every single experiment. I've taken every supplement to try things and detox myself and got sick so many times. So I am the human guinea pig. So,
well, we all thank you for your sacrifice. The audience, as always, is always on it. And you ask them, which increases your mortality risk, sugar or vegetable oils? 55% say it's vegetable oil and 45% say it's sugar. Any winners?
This will surprise you in a video that I will release. It's vegetable oils by a factor of quite a bit. There's only really two other things that are more deadly than vegetable oils. And that would be heavy smoking, as well as, let's see, what's the other one? Heavy smoking and obesity, really overweight. Other than that, sugar is kind of lower on the list. So stay tuned for that video. But these omega-6 fatty acids are very pro-inflammatory, and we need omega-6 fatty acids, but we definitely don't need the ratios of like an average person has 20 to 1, 20 omega-6 to only 1 omega-3 fatty acid. So that's like just way off the charts. And so in 2 videos I'm going to be doing this week, I'll be talking about that and what you can do to reverse that, because I mean, your body problems could be just a matter of making this adjustment of these 2 fats. And I'm also going to release a video on the simple way to do it, because not to make it too complex.
Okay, here's another interesting name, LabTech66 from YouTube. Says, I believe I am suffering from exposure to mold. I found a roof leak that wasn't repaired properly, and now I am exhausted with severe muscle and joint pain, chronic sinus and skin issues. What should I do to address these issues?
There's one really good remedy that's probably growing in your backyard or in the field down the road somewhere that you can get. It's called milk thistle. It's this prickly, huge plant that has these kind of like purple flowers that then turn white. And you can grab the seeds out of them, grind them up in a coffee grinder, and put them on your salad. And that actually, here I'm giving away the answer to the next quiz question. That can greatly neutralize poisons, okay, from mold, from snake bites, from poisonous mushrooms, and the list goes on. And that's all I'm going to say.
All right, well, that's it. And Terry's had enough of me. Every week he puts Canada second. He just admonished me for that. So I'll remember that. Canada, you're always represented thanks to Terry. Rylu from Facebook, thank you so much, Dr. Berg. Your heart is so generous. Thank you for all the information you have shared with us. There they go again, satisfied customer. So great to hear all his successes. And let's see. Lisa from Facebook, should someone who's recovering from a stroke still be feeling dizzy every day?
Well, ideally not, but it does take some time. There's a really good remedy that you can take to recover from stroke, and that's a good amount of vitamin E. Okay, and the one I would recommend is the tocotrienols. There's several studies that show that when you take the tocotrienols without the tocopherols, that can actually increase your recovery from stroke, because we have a lot of brain damage, and you need something fat soluble to penetrate the myelin sheath and open up the vascular part of your brain. So that's what I would recommend. And also the other thing I would do is I would do a lot of fasting. And then, of course, with your regular nutrients that you need when you fast.
All right, let's try another question, Doc. Here you go.
Okay. So does lemon acidify or alkalize our body?
Okay, and maybe that's an appropriate precursor to Cecilia from Facebook's question, an oft-asked question. Please educate us on how to treat acid reflux.
Typically what happens is that you have a weakened stomach acid situation where your pH is no longer between 1 and 3. It's 4, 5, even 6, or even 7. There was a test that I did in my clinic that you have a person swallow a pill that's on a string, and it goes down to their stomach, and you have them lay on their right side for about, I think, 10 minutes, and then you pull up the string and you measure the pH of that little capsule, which absorbs the acid. And it was like 1 for 1. People that have acid reflux, their pH was like 5, 6, sometimes neutral. I mean, that's crazy. So they didn't have very much stomach acid. So there's nothing to send signals to the valve on top of the stomach to keep it closed, that valve. So then it stays open and it regurgitates. You get acid reflux and heartburn. So the solution is to acidify the stomach. And what do people do? They alkalize the stomach. So if you acidify with betaine hydrochloride, take about 5 before a meal, go slow because you might have an ulcer. and then you can acidify the stomach. And then if you have an ulcer, you have to heal the stomach first with something like chlorophyll or wheatgrass juice powder, and then acidify it, let's say several months down the road. But Steve, the reason why I stopped doing that test, even though it was a great test, is one person had a really dry throat, and the capsule got stuck in her throat. So here I'm pulling the string up like a fish that's hooked down there, and I'm pulling, and it won't come out. And I said, you know what? I'm just going to cut the string and just swallow it and just let it go through the other way. But I said, that's it. I'm not doing this test anymore because this was scaring the heck out of me and that person.
Awful. Did you attend the funeral?
No, she survived fine.
Oh, thank goodness. Okay, and we have answers already on quiz question number 2, and it asks, does lemon acidify or alkalize your body? And our recipients said, our guest said, respondents, 77% say lemon alkalizes the body, and 23% say it acidifies the body.
So it initially acidifies, but the citric acid in citrus fruits will break down pretty quick within probably an hour, and oxidizes to an alkaline substance. So it'll alkalize people. And this is why people that have calcium deposits, that have arthritis, they're usually way too alkaline in the first place. And when they take citrus, especially the fruits, oh my gosh, about an hour later, they're stiff as a board. So they need to acidify their body, and that mobilizes the calcium. Because think about it, like if you go outside and you have your little faucet that has some calcium deposits on it, that's because the water is more alkaline. So when you acidify it, especially like having a really strong acid stomach, you can help keep the calcium from forming deposits throughout your body. So that's just a little tip. That's why apple cider vinegar is really good for arthritis.
Interesting. Okay, waiting patiently from, I think it's England, Texas, is Rainey. And Rainey, you are on, hang on, let me push the button here. You're on with Dr. Berg. Go ahead with your quick question, Rainey.
Hi, good morning. I'm from Ingram, Texas.
Oops.
Anyway, I'm 64 years old. I've been doing healthy keto and one meal a day for over 5 years. But since the pandemic, I increased my vitamin D3 to 30,000, but I didn't increase the K2. So I've been doing this for about 2+ years, since March of 2020. So I knew that keto and intermittent fasting is very anti-inflammatory, but I started developing arthritic symptoms in my wrist and my hands, my hips. And so it puzzled me. So I'm thinking possibly because I've been taking too much D and not enough K, could that be the reason why? And can it be reversed?
Yeah, I think it can be reversed. And yes, I think that's the reason why, because think about it. So vitamin D increases the calcium in the blood by a factor of like 20x. But if we don't have enough K2 from your diet that can take it from your blood to the bone, then it goes out through the joints and can aggravate arthritic type problems. So I would, for a while, not take any D and just take K2 until your joints feel better, and then go back to taking both of them together. That's why I always recommend taking both of them together. And in the ratio normally is like, if you have 10,000 IUs of vitamin D3, you would want about 100 micrograms of K2. In your case, you might want to do 4 times the K2 and then like half the vitamin D3, just to kind of balance you back to where you need to be. When people talk about vitamin D as being like 10,000 IUs, which I think is a good maintenance dose, sometimes they freak out. They think, oh my gosh, that's so much, 10,000 IUs. Well, 10,000 IUs is really only 250 micrograms, which is only 0.25 milligrams. So that's like 1/4 of 1 milligram. That's what 10,000 IU uses, but it sounds like such a big number. So I think that's all you need to do.
Okay, thank you.
Wonderful.
You're welcome.
Thank you so much for joining us, Rainey. And we'd love to hear back from you for your continued progress in your striving for health. So that is terrific. Let's see. Why don't we go back to social media, of course. Tanya from in Maryland on Facebook. I need help with thinning hair and bald spots. I can't find a dermatologist who will address these issues. Help.
So it sounds like alopecia. There's a great video I released. I don't know if you saw it, on a good tip for hair growth, which is basically Jello. But of course, I would do gelatin. I wouldn't do just regular, the artificial sweetener type stuff. But gelatin, which is also in collagen supplements, will help with alopecia and hair loss. Not in 100% of the cases. So there are other factors. There's hormonal issues, high DHA or DHT, I'm sorry. And also there could be a trace mineral deficiency possibly. So of course I'm not here to promote my products, but I do have a hair formula that you might want to consider because it has everything in it. But in the meantime, try to get some gelatin and see if that doesn't just help you. And the last thing I will mention, regardless of whatever symptom you have, including hair loss, you always want to kind of figure out, when did this thing start and what happened right before it, okay, to get the clue that you need, because there's always something in the background that might have triggered it to give you some idea on what to take or what to do.
Terrific. Let's go to Guillermo. I had it right before, now I can't say it. From Facebook, I usually boil a large pot of hibiscus tea and then put it in the fridge after it cools. Will it still keep its properties when it's consumed cold?
Yeah, absolutely.
All right, that's good to know. So chug away that nice cold brew you have there. Mickey from Facebook, could you address the issues of premature ejaculation and low levels of serotonin?
Well, again, I don't have your history. I would, for example, I mean, it could be a problem with what your diet is, especially when we're dealing with issues like erectile dysfunction, premature ejaculation, or even low testosterone. There could be many different reasons for that. It could be you have too much estrogen. It could be that you have insulin resistance in the arteries, not just in your private parts are a problem, but also in the artery, in the the arteries as well, in your heart. So it's I would watch my videos on the topic because I don't have a quick answer for that.
All right. Well, good luck, and thanks for your courage in asking a question that involves a lot of people. DMP from YouTube. I just finished a 21-day cycle of doxycycline after being diagnosed with Lyme disease. What do I do now? Thanks for your advice.
I feel for you. It's a nasty condition and it's a nasty treatment. You better be putting that probiotic back into your body for sure, or that good bacteria immediately, and start consuming foods that will build up, like the fermented vegetables. But I would now watch my video online because there's some natural things to take, because even like sometimes one round of antibiotics doesn't cut it, and they want to have you continue for a long time. But there are natural antibiotics like garlic, like oregano oil, thyme, sage, that you can take that don't affect your good bacteria, only the pathogen. The other thing is colloidal silver is a really good remedy for Lyme. It's a good remedy, and no, it won't turn your skin blue unless you drink a gallon of it. But the other thing too is that this nasty spirochete goes in there and hides into biofilms and spreads through the body. So I could probably spend an hour on what to do, but I think I would watch my videos, and then you're going to have to just keep working at it to keep your immune system really, really strong. That's really the key to the whole thing.
All right, very good. Evelyn from YouTube, I'm 60 years old and had a full hysterectomy 10 years ago. Can you please do a video on the nutrients women in our situation need, if you haven't already?
Well, I think I have, but I think it's a good idea to do a video on hysterectomy. I'll give you one tip. There's Standard Process has a really good product called Utrophin PMG. Okay, Utrophin PMG. I would find that product. I would take it. I would take 2 before bed. And it works really, really good for women who had a hysterectomy. So, but I will do a video on that because I think that's a good idea.
All right.
And I'm sure a lot of women have had that procedure. And, you know, it's just kind of a standard thing. It's like, probably this relates to having a uterine fibroid, in which case I should probably do a video on that as well. So.
Boy, I am so grateful for my simple hydraulics. I don't have to put up with all that. I tell you what, hats off to ladies for all that machinery, having to deal with it. And let's deal with the next question. Here it is, Doc.
All right, true or false? Sugar lowers your IQ.
Okay, Terry's anxious for that answer. And let's move on. How about to the green room? And this time we're going to go to Gerardo from San Francisco. And Gerardo, we appreciate, oh, hang on just a second, Doc. Let me fix something here. Your head's half cut off in that shot. And here we go. Gerardo, you're on with Dr. Berg.
Oh, hello, Dr. Berg. My name is Gerardo from San Francisco, California. I'm 63 years old. I've been doing your intermittent fasting for over 10 weeks now and doing mostly OMAD, following the same program you laid out in your dietary and supplements, taking A, B, C, D, zinc, cod liver oil, lemon water, apple cider vinegar, exercise, daily sunlight. I lost 15 pounds already after 6 weeks and have lots of energy and no more naps after meals. But my sleep is inconsistent, where I wake up 2 or 3 times, just like the other person, have a broken thermostat. I sleep with the eye mask, and I did some tweaks, so I cut down the number of, I only wake up once, but it's still inconsistent. And yesterday, your sleep aid and your electrolyte arrived, so I took those. And so sleep is still, I woke up once, lots of dreams. And is it my cortisol that is my problem? Any suggestions?
Yes, this is a really, really good question, because you have a clock, not only in your brain, but in all the cells as well. There's literally a tiny mechanism that is controlling the whole circadian rhythm of your sleep. And what the biggest stimulus of that is light and darkness. So unfortunately, the big problem that we have nowadays is we have an abundance of light, even in the dark. We have also a lot of artificial light. So there's a couple things that you can do in addition to what you're doing that I think will help you. Number one is, in the morning, if you could go outside and watch the sunrise, that would be a very therapeutic thing, because that will, at the right time, give your retina what it needs to start to reset. The other thing, if you could do this, okay, is to watch the sun set at night, because that will it tells the brain, okay, reset the clock. Those are the 2 reset things. But let's say you can't do that. Well, then you can get what's called bright light therapy, and you can buy a little lamp and you can expose like about 30 minutes in the morning to that bright light. Maybe that would be good in the winter too. But those 2 things, I think, will help you a lot, especially the one early in the morning. And then as far as the supplement that you took from the sleep aid, I would take 3 of those before about 20 minutes before you go to bed, not just one. If you're having any problem, that usually will also assist. But don't do everything at once. Try one thing at a time so you really can isolate what is going on. So that's what I would do.
All right. Sounds like great counsel. And we have another question answered by the astute audience. True, false? Sugar lowers your IQ. And 95% of your admirers say it's true, and 5% say it's false.
You know, I mainly asked it just to see if there was that 5%. I'm just curious about that 5%. I'm very curious about, like, there's people out there that don't think that sugar can lower IQ. It actually will. It literally makes your brain not connected to disconnects the neurons. I mean, if you think about even a diabetic, their IQ goes down by a certain amount of points. So yeah, sugar does destroy the brain, and it does lower your ability to problem solve, to be creative, to use the mental processes that you need to figure things out. So I'm going to release a video on the topic if I haven't already. I don't know if I did release that video. Yes, I did release the video. I did. I just remembered. I think that would be a really good video for you to watch on the cognitive function of how to increase it, and then what to do to avoid. That goes beyond just sugar too. There's other things you should avoid that inhibit your cognitive function. And I'm talking about your ability to put your attention on something and keep it there, because you're constantly filtering out extra data that you don't need. And that's really the problem, is the filter mechanism. Because when you actually study something, it's kind of like you have your cell phone, you have this, you have that. How well can you resist that additional information? When you have sugar, you lose those inhibitory filters. So now everything kind of goes in and you're kind of distracted easily. You have this deficit of attention. Someday they'll even probably come up with some label for some disease on that. But yeah, you'll have a deficit of attention.
What'd you say? No, I'm just kidding. So, boy, our viewership is really growing on YouTube and Facebook. So thanks, everybody, for joining Dr. Berg. Obviously, his counsel is welcome and popular, and it's just great to see that continuing on the rise. Let's see. Jessica from Facebook, can you share some tips on how to address weight gain while during menopause?
Okay, so how to maintain weight gain, or I'm guessing she wants to maintain her weight. She doesn't want to lose weight. Is that right? Or she wants to lose weight?
Let's see. Let me go back to that. Gain weight. I think she would rather, let's see, how to address weight gain. I think she wants to lose it.
Okay. Yeah, with menopause, we have a shift. We have a shift of hormones. We have a sudden shift, and that's really the shock to the system, the sudden shift of the decrease of estrogen, but more decrease in progesterone. And so now your body recruits help from the backup organ, which is the adrenals. And then the adrenals tend to create the cortisol and the belly fat and all the other symptoms that come with it. So we come right back full circle to the adrenal. How do you support a stressed adrenal? I have so many videos on that. If the cortisol is high, it's really hard to lose weight. So a couple little tips to lower cortisol would be to get adequate amount of vitamin D, to do regular exercise, to do regular physical work. Also, mental stress is probably one of the biggest things that relates to dealing with other people. So you really want to do what's called a stress detox. And, just kind of don't hang out with anyone that is stressing you out for a while. And that usually helps. But I would identify those individuals in your life that tend to stress you out. And they usually are bringing you bad news too. So you don't want to watch the news. You don't want to have too much bad news, because it keeps you from sleeping, and it keeps things stressed, and that can affect your weight as well.
Well, I'm flush with excitement because someone's asked me a question. Cookie Cutter Girl from YouTube, question for Steve. Can you eat too much nutritional yeast? Now, don't take my counsel, but I followed Dr. Berg's recommended daily allowance, which is 9 of these things, and it works very well for me. So, as anything, I think you can kill yourself from drinking too much water. So I don't go crazy, but I do trust very much what Dr. Berg says, and I get great results. Doc, am I on track here?
Probably just don't do more than a pound a day, Steve. I wouldn't do a pound a day.
Okay.
But I think nutritional yeast, it has an interesting flavor. So either you like it or you don't like it, but it's a good source of B vitamins, especially if you get it from the without the fortification or the synthetic additions of the B vitamins. Yes, they might work initially, but as a maintenance, you don't want to take anything synthetic. Because I did a video on that. I mean, the synthetic vitamins, basically mainly from China. They're from chemical companies. They make them from petroleum. So why would you want to put that in your body? But the nutritional yeast, even though the B vitamins might be lower than some fortified version of nutritional yeast, they still are more bioavailable, and they'll still work really nice. And they're more of a natural source. These microbes, man, I'm so interested in how these microbes help us. In fact, we are totally dependent on these microbes for all sorts of things in our body, for immune protection, digestion, making different vitamins, making different chemicals. The same thing with a plant. The plant is dependent on the microbes. You can't grow a healthy plant without microbes. The microbes they mobilize the minerals in the soil, but they even invade the roots, and they turn into, this is interesting. Okay, I'm getting distracted here, but you can have a pathogen that invades the root and becomes a friendly microbe and develops a symbiotic relationship with that plant. It goes right up into the root, up and even to the stem and leaves. So there's a whole new research on how microbes even are inside these plants. I mean, it makes sense because they're inside our bodies, and they were on the planet before the human bodies. And so you have a lot of interesting things with these bacterial and other microbial life, which I can study for hours.
That's interesting. Okay, Cookie. So use as Dr. Berg requires on his label for best results. I've certainly found that to be true. Okay, Patsy from Facebook. I've been on keto and OMAD for over a month, but have developed vertigo, and I'm just feeling very lethargic. What are your thoughts, Dr. Berg?
You know what? I think you need more sea salt. Sea salt. I think that's going to be the answer. I think that's going to be the simple answer. I would also, there's the other thing that if you take sea salt and it doesn't work, then you'd want to take a benfotiamine, which is a fat-soluble B1, which I doubt if you'll really need to do that after the sea salt, but I would start with the sea salt as a plan A.
Wonderful. Doc, how about another question? And you feared that you might have touched on this already, and there it is.
All right. What is the primary effect of milk thistle?
Climb on it, audience. Why don't we go back to the green room, and let's see. How about we went to her, Tracy. We've been to there. Let's see. Who else do we have here? We have Tracy. Hang on just a second. Let me get her on. Tracy, prepare yourself.
Yeah.
Because you are on with Dr. Berg with your quick question, please.
Hi, Dr. Berg. I've learned so much from your videos. Thank you for all you do. I've been doing standard keto and intermittent fasting for about a month. I'm eating 2 meals a day. I have adrenal fatigue with high cortisol. My blood sugar after 20 hours of fasting averages about 105, but my ketones are 0.5. Should I still be fasting with the adrenal fatigue?
Yes, because on that scale of ketones, we want to get it up to maybe 3 or more. So there's different levels of things you can do. The fact that your blood sugars are over 100 tells me there's either you had some really nasty insulin resistance that's keeping things from working like they should. So I would definitely do longer fasts and add exercise. Those are the two things that will start pushing the ketone level higher and higher and higher. But ideally, you want to do that until the blood sugars come down to about 80 or less.
Okay, thank you.
You're welcome.
All right. Thank you so much for your succinct question there. Let's go back to, oh, wow. Quiz. How about the quiz answers? So the latest quiz question number 4 asks, what is the primary effect of milk thistle? And the audience is very cocky. 100% of them say milk thistle heals or cleans the liver.
You know, I kind of gave away the answer there, but yes, they are all correct. Specifically, liver protection. It protects the liver against poison. A lot of different poisons. Poisons from medications, poisons from snake bite, poisons from poisonous mushrooms, poison from mold toxins. So it's quite interesting because, you know, I can go outside right now and I see milk thistle all over the place. And so I'm going to be collecting the seeds as soon as the flower turns white, and I'll be blending them up, and I'll be putting them in a little container and consuming them on a regular basis, just because as the more I study milk thistle, the more I'm amazed at what it can do. I mean, it's like serious liver protection, and also good for blood sugars and mood, and but what it does to the liver, because so many people have a toxic liver nowadays, you know, why not use a homemade remedy like that? And it's so easy to find the milk thistle. It's like all over the place. You just have to look up what it looks like.
All right, that's great. And I gave everybody a quick preview of Daniel somehow. His picture popped up. So why don't we just carry that further and bring him on to the show. Daniel, you are on with Dr. Berg for your brief question. Daniel, can you hear us? I guess Daniel is muted out. So let's go back to a full picture of you and go back to social media while we're waiting for him to get that together. Vicky from Facebook. I am a nurse, and your information is much more helpful and on the spot than any of my doctors. Hi, oh, wait a minute. Here we've got him. Just a moment, Daniel. Let's bring you back up. There you go. You're on with Dr. Berg, Daniel. We have some technical difficulty with Daniel. So, Daniel, I'm sorry, but we're going to have to put you back in the green room for a while until we figure out what your audio problem is. So anyway, isn't that interesting, Dr. Berg, that Vicky, a nurse, has found your information more spot on than any of the doctors? That's hopeful. So thank you for that acknowledgement. You know, I think sometimes.
Yeah. So let's see if we can get Daniel. Daniel, can you hear me?
Daniel, can you hear us? Yeah.
I think we can hear him, but he can't hear us.
That's probably the issue. I'm not sure why that is. I spoke with him earlier, and he cheerfully addressed us. But hang on just a second. No, just can't get him to go. But we're not going to give up on him, certainly. Let's go to.
Okay, so he just said he just said yes. So why don't you tell me, Daniel, your question? Okay. So maybe you can't hear me for some reason.
Interesting. Well, that saddens both of us, but we'll keep that in mind. I tell you what, why don't we go to our final question as we wait for Daniel to come about. And here it is.
Yeah, but there's a severe delay. So why don't you go ahead and ask your question? Oh, you can hear me now. Okay, great. Go ahead. What's your question? What you might want to do is type in your question, because either there's a delay or something. I don't know what's happening, but
yes, Doctor. So, Great. So I've been. So here's a little bit of background. I've been doing your keto and intermittent fasting for about 3.5 months.
Daniel, if you can hear us, go on with your question.
So, Steve, why don't you just text him to ask the question in the chat, and we'll put him on mute because it kind of comes in and out. So,
And sorry about the delay. I don't know what's happening, but yes, and so I've lost about 25 pounds.
Boy, the suspense is killing us.
yeah, Steve, why don't you just put him on pause and tell him to type in the, and we'll go to, what about, let's see, did we,
I think we've gone to everyone now.
yeah, I don't know what to do.
Let's see. Did we get to Tracy?
No.
In North Carolina, we
did we
did
do
not.
Raina and Tracy?
Yeah. Tracy, you there? Oh, no, we did.
I'm here. I already asked.
Yeah, that's
I
right.
asked my question.
Oh, good. Thank you, Tracy. Yeah, we're all sort of caught up here. So we
And
do.
what about Raina? Raina spray? Did we do Raina?
We did.
Okay.
We did, from Texas, and she was very entertaining.
Yeah. Okay, good.
And then let's see. How about the last question for the day? Here it is.
Yeah. All right. So let's see. True or false? The lack of diversity of your microbiome can contribute to depression. Is that true or false?
Okay. And then meanwhile, poor Daniel dropped off completely. So we hope, Daniel, when you're watching this on YouTube or Facebook, please write us back and type in your question, and we'll get it. Oh, he just popped back up, but I'll write him back. So audience, climb on that question. And then let's go back to the very patient folks on social media. Okay, Charles from Facebook, what are your thoughts about alkaline water and ionized water?
Yeah, I really don't have an opinion on ionized water, but alkaline water, I don't like it unless it's naturally alkaline from spring water. That's what it normally is. But when you start to alkalize water, I actually did a urine test on quite a few people, and when they did the alkaline water, their urine pH was a 9. Now, normally it should be like 5.5 to 6.5. And when you have 9, that's like just off the charts. So I'm like, that's too high. We need that pH in the urine to be a certain level. And when you start alkalizing the entire body, that's not the best way to do it. You want to just find out why your body's too acid in the first place and correct that reason instead of just alkalizing the whole body, because every part of the body is a different pH. And when you alkalize the entire body, you kind of throw off everything. So if you eat healthy, your body will go back to the pH it needs to be in.
Very good. Adu from Facebook, what foods are best for someone with scleroderma, and can it be cured?
Well, you'd want foods that are good as an anti-inflammatory. So, of course, the obvious is to avoid the omega-6 oils, the sugars, the wheat, the grains, and things like that. But vitamin D is one of the best remedies for inflammatory skin problems, inflammation. And I do want to say, I do have this is a little plug for my new liquid vitamin D K2 product that has zinc and MCT oil. Because, some people don't like capsules, and they also kids have a hard time with capsules. That's a good new product to take. And it tastes good too. It's like a lemon mint. So I just wanted to do a plug on my own product. But for skin problems, you need vitamin D. Vitamin D is the best for inflammatory skin issues. You can get it from the sun. So you don't really have to take a vitamin E supplement. But in fact, kids that have like scleroderma, or they have psoriasis or even eczema, if they're out in the sun, it seems to clear up. So that's a interesting coincidence.
Interesting. Well, I tell you what, this must be National Dr. Berg Nurse Appreciation Day, because here we have another one. I'm Christina, I think I'm a nurse in a hospital. I'm also a home care nurse, and I recommend your videos to all my patients in regard to whatever ailments they might have. And she claims, as the other one did, you are the best. So thanks, folks, for reporting, especially from the...
No, I just want to say I really appreciate that, because there's quite a few doctors that are watching and recommending the videos. I mean, like, I'm just giving helpful tips that anyone could use, especially in the medical profession. I mean, these things have been tested. We have well over 5,000 success stories on the website. So might as well share this information and use it, because I don't think anyone should keep their information hidden or secret or mysterious. If you have something that works, tell other people, and that's what it's all about.
Yeah, I have a good doctor, a good plastic surgeon buddy, and he says many doctors, because of their specialty, get tunnel vision, and they just know a lot about one thing, and just, maybe they're too busy or distracted, but they just don't see outside of that tube. And he says it's really excellent to do some research on the side. So anyway, I think you're great. And in his case, he said, so Dr. Berg is terrific. Learn a lot from him. If you need a facelift, I can help. But otherwise, my knowledge of medicine is in a very sort of narrow channel.
Yeah, and it's also, it takes time to dive in and try to sort things out. Unfortunately, I have a very strange interest in studying health information all day and then trying to understand it and try to package it in a way that people can understand it. So not a lot of people read textbooks as a hobby or for fun. For some reason, I just I enjoy that. So that's one of the pluses and minuses of my enjoyment.
Well, we're all the great benefactors of your energy in that regard. Okay, last question. True, falser? The lack of diversity in your microbiome can contribute to depression. And 95% of our audience say it's true, and 5% say no way.
This is, I'm just curious about that 5%. I just thought it was common knowledge, but you have this gut-brain axis, this connection through the vagus nerve. I'm telling you, your mood is hugely affected by what's happening in your gut, especially after you do an antibiotic. I mean, you could literally go into some anxiety, depression. So, it's, think about what the microbes are doing. They make neurotransmitters, and they influence a lot of chemistry in our body. So, if your gut is really good and everything's working and you have the diversity because your diet's good, and you're going to feel better. You're going to feel better in your head. So there's definitely a huge connection. It's way bigger than what people think. In fact, even there's certain research within, especially like on animal studies. Okay, it's just like in mice studies. They put mice on they destroy their microbes, right? And they experience symptoms almost identical to autism. Now that's interesting. Autistic symptoms, which is a whole different thing, but still it's an interesting connection that's connected to the microbiome. So if my child had autism, you better believe it, I would be fortifying them with probiotics, fermented vegetables, getting rid of the sugar. I would be all over that.
Well, that's wonderful, Dr. Berg. Guess what? We've done it again. We got through all our questions, and it's about that time.
Listen, I want to thank you guys again. You guys have great questions. I appreciate all the comments on my channel. I read a lot of them. And stay tuned for some additional really interesting videos coming up this next week. Have a good weekend.